In October 2024, Lauren Bannon sat in a doctor's office in North Carolina and heard the word cancer for the first time. She had been sick for 8 months. She had seen multiple doctors. She had been given 2 diagnoses, neither of them correct. She had been told her joints hurt because of rheumatoid arthritis. She had been told she was losing weight because of acid reflux. She had taken medication for conditions she didn't have. None of the doctors had found the cancer. A chatbot had. Not a medical system. Not a hospital algorithm. ChatGPT, the same tool she used to write marketing emails for her business, had looked at her symptoms, connected dots that 4 months of doctor visits had missed, and told her what to ask for next. By January 2025, Lauren Bannon was in surgery, having her thyroid removed. If I hadn't looked on ChatGPT, she said, the cancer would have spread from my neck to everywhere else. Lauren Bannon is 40 years old, a mother of 2, and the owner of a marketing company. She splits her time between North Carolina and the U.S. Virgin Islands. She is, by every account, the kind of person who handles things, who finds solutions, navigates problems, pushes through. In February 2024, she noticed something small and strange. Her fingers were stiff in the mornings. Not painful exactly, just resistant, difficult to bend when she woke up. She assumed it would pass. It didn't. She made an appointment. And then another. And another. After 4 months of visits, a doctor diagnosed her with rheumatoid arthritis. This was unusual in itself, the tests had come back negative. But the doctor looked at the symptoms, considered the presentation, and gave her a name for what she was experiencing. Then things got worse. Bannon began having severe stomach pain. She lost 14 pounds in a single month. Her energy disappeared. She felt, she would later say, like something was fundamentally wrong, a kind of cellular alarm that she couldn't explain and couldn't turn off. The doctors had an explanation for that too: acid reflux. 2 conditions. 2 medications. And a growing sense that something wasn't adding up. I just felt so desperate, she said. I just wasn't getting the answers I needed. She'd been using ChatGPT for work. She knew what it could do. One evening, without a clear plan, she opened it and started typing. Lauren Bannon typed a question into ChatGPT. Not a medical query, exactly, more like a conversation. She described her symptoms: the joint stiffness, the weight loss, the stomach pain. She asked what else could cause a pattern that looked like rheumatoid arthritis but wasn't responding to treatment. The chatbot gave her an answer she hadn't heard before. Hashimoto's disease. An autoimmune condition where the body's immune system attacks the thyroid gland, causing inflammation and eventually underactivity. The thyroid is a small gland at the base of the neck. It regulates metabolism, energy, weight, and several other systems. When it starts failing, the effects ripple outward: joint pain, weight changes, fatigue, digestive issues. The symptoms fit precisely. ChatGPT told her to ask her doctor to check her thyroid peroxidase antibody levels, TPO antibodies, the specific marker for Hashimoto's. It even named the test. Bannon went back to her doctor and made the request. The doctor was skeptical. Bannon had no family history of thyroid conditions. Her symptoms didn't fit the classic presentation. But Bannon pushed. She had a specific test in mind, a specific reason for asking. The doctor agreed. In September 2024, the results came back. ChatGPT was right. The antibodies were elevated. She had Hashimoto's disease. Now that the thyroid was on the table, the next step was an ultrasound. Standard practice when thyroid dysfunction is confirmed. The imaging showed something the blood test couldn't have caught alone: 2 small lumps in Lauren Bannon's neck. They were confirmed as cancerous in October 2024. 8 months after she first noticed her fingers were stiff in the morning, she had a diagnosis. Not from the doctor who had been treating her for rheumatoid arthritis. Not from the one who told her she had acid reflux. From a chatbot she'd asked a question of at 11 o'clock on a weeknight. Lauren Bannon's situation was not an anomaly. In early 2024, Marley Garnreiter, 27, began experiencing night sweats and persistent itching. Her father had just died of colon cancer. She was grieving, exhausted, afraid. Doctors ran tests. Nothing came back. She consulted ChatGPT. The chatbot suggested blood cancer. She dismissed it: it seemed too alarming, Too unlikely. She kept going. Months later, her symptoms worsened: chest pain, extreme fatigue, difficulty breathing. A follow-up examination found a large mass on her lung. Hodgkin lymphoma, the exact condition ChatGPT had flagged nearly a year earlier. 2 women. 2 cancers. Both missed by the medical system. Both caught, first, by AI. There are more. A man in Oregon whose persistent fatigue had been attributed to stress discovered, through a conversation with an AI, that his symptoms matched those of a rare adrenal disorder. He asked for the test. He had the disorder. A woman in Texas whose doctor dismissed her chest tightness as anxiety, she described her symptoms to Claude, was pointed toward a possible cardiac condition, insisted on a stress test, and was referred to a cardiologist who found a structural issue. These are not isolated accidents. They are the visible edge of a pattern. And the pattern points to something uncomfortable about how medicine works at scale. This is not a story about AI being better than doctors. It's a story about what the medical system is optimized to do, and what it isn't. Doctors see patients for minutes at a time. They work from symptom checklists and probability distributions. They specialize, which means they look at specific body systems while other systems remain outside their view. A rheumatologist looks at joints. A gastroenterologist looks at the stomach. Nobody, necessarily, is looking at the full picture, at the pattern formed by all the symptoms together, the way they interact, what they might collectively suggest. Lauren Bannon's symptoms, individually, were plausible fits for the diagnoses she received. Joint stiffness, rheumatoid arthritis. Weight loss and stomach pain, acid reflux. Each doctor was doing what they were trained to do. The problem was that the system didn't allow anyone to see the complete shape of what was happening. A 15-minute appointment has a natural logic: identify the most likely explanation, treat for it, follow up if it doesn't resolve. Most of the time, this works. Most of the time, the most likely explanation is correct. But Bannon was not most of the time. She was one of the cases where the surface symptoms pointed in one direction while the underlying cause pointed somewhere else entirely. And the fragmented structure of her care, different specialists, different appointments, different record systems that didn't talk to each other, meant no one was ever holding all the pieces simultaneously. ChatGPT isn't trained on a single specialty. It has no obligation to keep the visit under 15 minutes. It doesn't have a waiting room full of other patients. When Bannon described her symptoms, the model processed all of them simultaneously, and found the pattern that connected them. That is both reassuring and terrifying. Reassuring because the capability exists. Terrifying because it took 8 months, 2 wrong diagnoses, and a midnight conversation with a chatbot for a woman to find out she had cancer. The research on this question has been accelerating. In 2024, a study published in JAMA Network Open evaluated ChatGPT-4's ability to generate differential diagnoses, lists of possible conditions that could explain a patient's symptoms. Compared to the diagnoses initially offered by treating physicians, the AI included the correct diagnosis in its top possibilities significantly more often. It considered rarer conditions. It didn't default to the most common explanation. Researchers at UCLA and UCSF have been studying AI embedded in electronic health records, algorithms that scan patient data continuously, looking for patterns that signal rare conditions years before standard diagnosis would catch them. In one study, out of 100 patients ranked highest risk by an AI program, 74 were confirmed to have a rare immune disorder they hadn't yet been diagnosed with. The potential, according to these researchers, is to catch diseases that currently take an average of 5 years or more to diagnose, catching them in time to treat, before the damage compounds. At Google DeepMind, researchers have built AI systems capable of identifying diabetic retinopathy from retinal scans, at accuracy rates that match or exceed trained ophthalmologists. Similar systems are being developed for radiology, dermatology, and cardiology. In every case, the pitch is the same: the AI sees everything at once. It doesn't get tired at the end of a shift. It doesn't anchor on the most likely explanation and stop looking. The technology, used well, could find the cancers that Lauren Bannon's doctors missed, before they've grown large enough to require surgery. That is not a small thing. That is the difference between a scan and a funeral. But the technology is not deployed at scale in the clinics where most people receive care. It exists in research papers and pilot programs in well-funded hospital systems in large cities. It does not exist in the 15-minute appointment in a suburban clinic where a woman is told her joint stiffness is probably arthritis. So patients are doing what they can with what they have. They are opening their laptops at 11 o'clock at night and typing their symptoms into a chatbot. In January 2025, Lauren Bannon underwent surgery. Her thyroid was removed, along with 2 lymph nodes from her neck. The surgery was successful. She now requires ongoing monitoring and medication to replace the thyroid function the gland had been providing. She is alive. I felt let down by doctors, she said. It was almost like they were just trying to give out medication for anything to get you in and out the door. That is an uncomfortable sentence. Because the doctors who treated her were almost certainly not negligent. They were following procedures. They were applying evidence-based medicine to the information available to them. The system they work within isn't designed to catch rare autoimmune conditions hiding behind common symptoms. Most of the time, acid reflux is acid reflux. Most of the time, joint pain is joint pain. What Bannon's case reveals is not that doctors are failing. It's that the structure of how care is delivered, fragmented, time-pressured, specialty siloed, creates blind spots that are invisible to everyone operating inside it. The blind spot isn't a person's mistake. It's a system's design. And a language model, sitting outside the design, can sometimes see what the system cannot. In 2024, a woman in North Carolina opened a chatbot at 11 o'clock at night and asked it why she felt sick. 8 months of doctor visits hadn't found the answer. The chatbot found it in one conversation. She had surgery. She survived. The cancer is gone. And somewhere right now, there are people in the same waiting rooms Lauren Bannon sat in, describing the same kinds of symptoms, receiving the same kinds of diagnoses. Most of them don't have cancer. But some of them do. And the system that is supposed to catch it isn't built to see what a language model can see in a single session. The doctors aren't villains in this story. The system isn't malicious. But it is slow. It is fragmented. It is optimized for the common case. The AI doesn't know you're a person. It doesn't look you in the eye. It won't hold your hand in the waiting room. But it will hold all your symptoms at once, connect them without compartmentalizing, and ask the question no specialist thought to ask. Lauren Bannon asked the question at 11 at night, alone with her laptop and her fear. The chatbot answered. The doctor hadn't. If you think more people need to hear this story, share it. And subscribe, because this isn't the last time AI changes someone's life. What does it mean when the best diagnostic conversation you can have is with a machine?